UBC, inspiring Uganda.
You Health Chat is a show that covers a variety of health topics to help people take control of their health. It is proudly sponsored by national medical stores who are mandated to procure, store, and distribute essential medicines and medical supplies to public health facilities in Uganda.
A very good evening to you watching UBC TV. Thank you so much for joining me on You Health Chat. My name is Sophia Matovu. And the purpose as to why National Medical Stores opted to come on board is to help us. You know, you don't have to keep all the time thinking that when it comes to health, no. It's a very difficult thing to manage. What is your condition? Is it one that can be cured? If it can't, how do you live with your condition? That is the purpose for us coming before you in your living rooms or at a place of your convenience to be able to bring these topics to you. Now today, we are going to talk about a condition that's got to do with your eyesight, and that is called glaucoma. It is called the silent thief. It will steal your sight way before you know it. And given the fact that this is the week when we have a lot of activities to do a bit of sensitization on the eyesight, why not come down to Mulago Hospital, where I have found this beautiful ophthalmologist, and she's called Dr. Immaculate Atkunda. Doctor, how are you?
I'm fine. How are you?
Fine, thank you. I don't take it for granted that we know when we talk about glaucoma what it is. Most times people think the time you encounter with an ophthalmologist like with you, it's when we need reading glasses or permanent glasses, and that's it. What is glaucoma?
So glaucoma is a disease that affects the nerve of the eye. So it damages that nerve, and that nerve is very important because the eye acts as a camera, just captures an image. Now for us to know what that image is, this nerve takes that image and takes it to your brain, and then you're able to tell what you're seeing. So damage to that nerve means that even if the eye is functioning well and capturing the image, you're not able to identify what you're seeing.
Okay. How common is this condition here in Uganda?
So we find that it's becoming even more and more common, and about 5 in 100 people suffer from this condition. And here in this clinic, we see about 100 people every month who actually come with this condition. And unfortunately, most of these people come at a stage where the damage to that nerve is very advanced. And the nature of this disease is that the earlier you find it, the better you're able to halt it in its early stages, because there is no treatment that can reverse the damage to this nerve. Okay. So the earlier you find it, the better. What
is the cause of the condition?
So there isn't one clear cause, but usually the common thing that causes damage to this nerve is the pressure within the eye becoming high. But also we find that sometimes just the nerve, the way it was made, is just a bit more sensitive. It's not just only the pressure in the eye, but also the nerve can be from how it was made, which is why we say if you have someone in your family that has suffered from the disease, you need to have it checked, because you find that just that the nerve is more susceptible to getting damaged by the pressure in the eye.
So it's not this kind of condition where you say that somebody needs to have diabetes and any of those other, conditions for it to affect the nerve of the eye.
There are other things that can work on the pressure to increase the pressure that can still result in a condition. One of the things that actually we commonly see are people who use these eye drops. They contain a particular group of drugs called steroids. And we see that many people, you get an itching in your eye or any eye discomfort, you go to the pharmacy and they give you a drop. Mm-hmm. And these drops contain these things called steroids. And these steroids, when used without the guidance of actually an expert, they can cause your eye pressure to go up, which can also result in this disease. Wow. Another thing that we see is with age. People above 40 years are more likely to suffer from the condition. So if, although we are now starting to see even people a bit younger, even below 30, and so the understanding of the disease, we are getting more and more, because initially we were using information from the whites, and now we are studying it more, and we're actually finding that among our people, even people as young as 30 are having this disease.
Wow.
So if you attend it, because it is silent and it's not painful, it means that for anyone, at least once you hit 40 years of age, you should be going for regular checkups to check your pressure, so that if you have this disease, it's caught in its early stages.
Mm-hmm. So how regular should those checkups be?
They should be annual.
Annual?
Yeah.
Okay. Now, what are the signs and symptoms? Because given that it is something that will just snap out of nowhere, for you've been very comfortable with your eyes and you do not know it's coming to steal your sight, how are there any four signs and symptoms that one is able to say, when I feel this, then I know that glaucoma is just around the corner?
So unfortunately, as even you started talking about it, why we call it the silent thief of sight, it is very silent. You won't feel pain, you won't quickly notice that your eyes are not seeing well. By the time you notice that, actually, by the time you notice you as the person, that you're not able to see well, it is too late.
So is there a cure?
Maybe I just wanted to explain a bit more. The nature of the disease is that how it comes is that it first damages your ability to see things on the sides, but you may not notice it. You just still be able to see everything clearly at the front of you. So you normally have life. Maybe if you're driving, you may start noticing that you're not seeing very well, like when borders are driving and coming from the sides, maybe you may not. But you see, this is such a small thing, and even it happens later on in the disease that you may not notice until a time when now you're seeing at the front, which you will quickly notice reduces. That is in the last stages of the disease. So the best way is come and be checked regularly, and for it to be caught in its early stages.
So does it have a cure?
There is no cure for glaucoma, but there is treatment that at whatever stage we find you, we halt the progress of the disease so that there isn't any further damage to the nerve. So we have different ways that we manage it. It could be through eye drops, but that means you'll be on that treatment for the rest of your life. Because I've seen some people get eye drops and they're told that, and they think this is a cure, and then once the pressure goes down, you go away. But you have to be on this treatment to keep the pressure low enough so that there's no more damage happening to your nerve.
Wow.
But there are also surgeries that are done that are also helpful. Some with laser, some that are done with our hands that also help. But the main aim of the treatment is not to reverse the disease, because the nature of the nerve is that once it's damaged, it's permanent. So the earlier you are able to find early, the better you are to get the treatment to halt the disease progressing any further.
Now, what I'm going to ask you is in line with what you have seen over the years.
All right.
In line with your practice. How do you manage to deal with some patients who actually you've observed, you've examined, and you recommend surgery, but many people are afraid? There's a perception and a myth out there that once they touch your eyes to do surgery, you're going to become permanently blind. How do you deal with that?
No, because you find that most of those people there's just that one person in the village who got surgery, and you're not even clear, because there are many surgeries we do on the eyes, and you're not even clear what surgery has been done. But you because sometimes this is a person maybe who even had an infection that they had spent long without coming to hospital for, and it had eaten up their whole eye, and then we had to work on it. But by the time they came, it was too late to do much to save the sight. So you hear a story from such a person, and you generalize that surgeries to the eye, you're not able to see. There are different surgeries, so it's best that you talk to your doctor, and your doctor will be very clear with you what kind of surgery is being done and for what purpose. If we are doing a surgery for glaucoma, it's different from another common surgery that we do for cataract. Surgery for glaucoma doesn't improve what you're seeing, it maintains what you're seeing. If you're going to do a surgery for cataract, a cataract is something that takes away sight, and it's just a lens, and then we remove that thing that is blocking your seeing and we replace it with an artificial, and then you're able to see. That is a different surgery. Then there are other different surgeries that we do. So when you generalize and you're not clear on what exactly was done, then that causes the misconception. So you usually have to explain that you don't know what was done for the other person and for why. So it's not a generalizable thing.
For the period of time you've been dealing with this, because I'm quite amazed that you actually even lecture and you're passionate about seeing other ophthalmologists coming up on board.
Yes.
Now, what can you say has been your best moment in dealing with the condition of glaucoma?
So glaucoma is a difficult disease because the people come and the management is not as satisfying as sometimes of other diseases which you cure, but you have to move with these people for the rest of their life. So the satisfying time, because as I said, is genetic, is when you find someone, yes, they may have already received some damage to their nerve, but then you send them to bring their relatives, and you catch now in their relatives at an early stage, and you're able to save their sight. That is really one of the things I find satisfying, that even if this person has come, maybe when it's late, you can use them to go and bring the other people, and you're able to save their sight.
Now, in terms of the eye drops that you're able to use when somebody already has the condition,
Yes.
What type of eye drops are they? Because you might need to help us, because certain times we have the cancer of any drugs for us, as long as you go to our pharmacy, they are particular off-the-counter drugs, but we are able to access any form of medication we need, with or without the prescription of the doctor.
So about drugs, I just want to tell the public that thing of going to the pharmacy and picking Probeta N. Probeta N is a danger, and it's a common thing that people walk into the pharmacy and pick, and regardless of what the problem is. And it's one of the things that actually can cause this condition. Repeated use of Probeta N is a problem. The other drugs that are for managing now this condition, there are a variety, and you're going to first be assessed and determined. There are many different categories, but their main point is actually they work on reducing the pressure. We have numbers like Timorol is a common one that is actually available and provided by the government, but all these drugs are given by a trained personnel. You can't walk into it's not good to walk into the pharmacy and buy these drugs, because we give them to you and we are going to continue monitoring and determine if there is need to change, if these are not working well for you and there is need to change.
At what point do people use this? Do you call them the teardrops or so? And why are they used?
Or the ones you're saying, the lubricants. So it's another common disease that happens as people age, because as I said, also glaucoma becomes more and more common as people age. So it's called dry eye disease. Your eyes are no longer producing sufficient lubrication for themselves, and so that's why you're seeing those lubricant drops come in. They're really benign. They don't have any much. They just do lubrication and they don't have bad side effects to them. But we also usually prescribe them after assessing you and determining that you have that condition, dry eye disease.
Okay. So at this particular point, I'd like us to get into a tour with the doctor, and she may take us, and let's see the process they go through as they do the eye examination, and then we will be back.
My name is Dr. Immaculate Atkunda. I am an ophthalmologist and also lecturer at Makerere University, where we train more ophthalmologists so that we have more people taking care of our eyes in the country. Here we are at the eye clinic at Mulago Hospital, where the doctors are trained and also we see patients. So when a patient first comes to the clinic, this is where we start from with doing a check for the eyes. We are told to read the charts behind us. You're usually asked to stand at 6 meters away, which is, if you have a patient about 6 meters away, and told to face the chart and read. We usually do one eye at a time so that we are able to tell each eye independently of what they are able to do. So you cover your one eye, So we'll start with the right eye. You cover your left eye. And are you able to see the chart, the one to your left? And the topmost letter?
Yes.
So you will read until where you stop.
X,
Yes?
T, Y, U, M, V, H, O, A, X, W, Y, U, T, M, A, X, H, Y, W, O, M, I, U, H, V, T, A, O, Y, W, T, M, A, H, U.
Okay, so then we would repeat the same for the left. Now you would cover the right eye and use the left eye. If it is a child or someone who is not able to read, in that case we would use the other chart that has pictures, and you just tell us what picture you have. Yes.
A duck,
Yes.
a star, a car, the moon, a house, a cup, a tree, duck, star, car, cup, star, house, duck, house, car, star, cup, moon, tree, car, duck, cup, star, house, moon, I don't see the next thing, tree, duck, car, house.
Okay. So since you're able to see all of them, you have good vision. But some people you might find that they just can only see the one on top, or even can barely see the chart. So that this gives us an idea on what you're able to see. So once you are done with this, then next we go into the clinic. So you can come with me. So we'll go in here. Once you come and you get into the doctor's room, you'll usually have the doctor asking you particular information. Have you noticed any change in how you're seeing? Especially if you're, for example, a driver, you find that people coming from the side, you're not able to see them because glaucoma tends to affect how you see on the sides much earlier than how you see things that are coming towards you. We also want to know if anyone in your family has gone blind, because it has a genetic component to it, meaning that people who have family members who have gone blind, they may have gone blind due to glaucoma and they are unaware, and then you're also having a similar problem. So we usually want to know about that. So after we've talked to you about and gotten all that information, then we'll proceed to examine your eyes. And what we have here is a machine called a slit lamp, which just helps us to look generally at your eye. And it has this small thing that helps us measure the pressure of your eye. I won't be able to do this now practically because it touches your eye. We put a dropper and it touches your eye, and it's able to measure the pressure of your eye. Alternatively, we have a handheld machine here that we use that can also measure the pressure of the eye. This one is digital, while this one has a scale that we read off from. So this one is less irritating, so I'm going to just do this practically. Just ask you to look over there. You just feel something lightly tap your eye. It's not painful, and it will help us tell you the pressure. So as you can see from here, this now tells us that the pressure in that eye is 13. Then we can repeat the same for the other eye. And in this eye it is 10, in which case that's normal pressure. The normal pressure of the eyes is from 10 up to 21, so within that range. So she had 10 and 13, which is normal pressure. So you can come with me. So we'll go in here. So after using another machine, the slit lamp, to see the front part of the eye, we usually want to see the back of the eye, because this disease, glaucoma, is actually a disease that affects the nerve that is at the back of the eye. So we always have to now afterwards go do further examination of the back of the eye. One of the things that we can use that is common, at least in almost all the units you will go to, is this machine. It's called a direct ophthalmoscope, and it helps us to focus beyond the front of the eye to see the back and see how the nerve is doing. So when you'll usually have this light directed at you, and we look through to try to focus at the back of your eye to see the nerve. And usually now what we will see is what this machine can also show you. This is just called a camera that takes pictures of the back of the eye. It's called a fundus camera. And what the kind of picture we'll see is what we are showing you here. This isn't the normal how the normal looks. I tried to look for one that was showing some damage to the nerve. This part is the nerve, and this is the rest of the back of the eye. And when you see that now this has started becoming white, and this a bit of dark part is part of the damage that we are looking for when we are examining the eye. So we have that, and if we notice that there has been some changes to the normal appearance of the nerve due to the disease of glaucoma, then we'll usually want to know the extent of the damage to do a more detailed study of the nerve. So this machine is called a visual field analyzer, and it helps us to better appreciate how much the nerve has been damaged by the disease. So it helps us, because the disease usually you can find that you're able to see very well at the front, but the sides usually first affects the sides of how you see, and then slowly by the time it affects the front that you're able to appreciate, it's already too late in the disease. So if we find it early enough, we can tell already that there are small damages to small parts of the nerve using this machine, and then we are able to start you early enough on treatment.
That was a very interesting tour. It makes us to be able to understand, because most times when we go to, now tell me the difference, the ones who we get, they're also ophthalmologists when we go to get our specs, our reading glasses.
They are optometrists and opticians.
Now those are the ones, the opticians, yeah, right, that's the right word. Those are the ones that most people I think have had a chance to interact with, that this tour you have taken us through on how we examine the eye has been more in-depth. So I guess a person who is watching out there is going to get down to appreciate and to value their eyes a lot more. Because I think we're used to more of these other things, malaria, what. The eyes are normally safe. But now when you talk about glaucoma, it's really worrying. So what's your final message and a word to a person who is watching you out there as we get down to commemorate or to go through the whole week of glaucoma?
So my message is we need to love our eyes. That has been actually our theme for this year, is love your eyes. And part of loving your eyes is going for regular checkups of your eyes. If you're someone who is above 40 years of age, or if you know someone in your family who has had blindness, it's good for you to go for regular checkups in order to be able to keep your sight. You do not want to fall victim to this silent thief of sight.
Okay. Thank you so much. Let's take a break, and when we do come back, we're still going to share with you a little bit more about this condition. Welcome back from that short break, and we're still talking about an eye condition called glaucoma, which we call the silent, thief that will steal your sight within a short period of time. You not even realize it. Now, having heard from Dr. Immaculate, with me on set is none other than a senior, an expert, and this is Dr. Geoffrey Wabulembo. He is an expert. I think I would use the word expert. These are the seniors when it comes to issues of eye health. And he's also a medical director that is at Light for the World. Doctor, you're most welcome on set.
Thank you, and good evening, viewers.
Okay. Now, first tell me about when we talk about what is Light for the World.
Yeah, Light for the World is an international organization which focuses on empowering people with disabilities and also preventing disability from happening. So we have programs that support people with disabilities to engage in productive activities that empower them economically. We also have programs that enable children with disabilities to be able to attend school. We also support people with disabilities to access assistive devices. And in addition to all that, we have comprehensive eye health programs in Uganda, Ethiopia, Mozambique, and Burkina Faso. Yeah.
Okay, now among them, of course, I can see that is clearly out there. What partnership or how are you working closely with Mulago Hospital to see that you support them when it comes to eye health?
Yes, we work with Mulago Hospital, but as part of the partnership we have with Ministry of Health.
Oh, okay.
Yeah, because in Uganda we are supporting a program called 123 I Can See. It's a child eye health program where we aim at reaching children at an early age who may have visual impairment and ensuring that they access all the support that they need in terms of treatment, but also in terms of their education. So we have school screening programs. We also have some community screening programs for children with visual impairment that may need surgery. And so we also facilitate their access to places where they can be operated upon.
Okay.
Yeah.
Now, during this week, the Glaucoma Week, what is your input as an organization?
Yes, Light for the World has glaucoma very close to our hearts. We piloted and developed a manual called the Glaucoma Toolkit for Sub-Saharan Africa. This is a manual that simplifies the management of glaucoma. Like my colleague mentioned, it's a complex disease. But in this manual, we try to break down elements of it that can be managed by people of various levels of qualification, right from the grassroots level to the most senior person. So this glaucoma toolkit was launched in 2021 in most of the African countries in partnership with another organization called COEXA. COEXA is a professional body for ophthalmologists of Eastern, Central, and Southern Africa. So our contribution with regard to management of glaucoma has been development of that toolkit. But as an organization, we also offer fellowship trainings for ophthalmologists so that they can go deeper into the skills and management options for glaucoma. So we've sponsored some students to do fellowship trainings, and we still are committed to doing that. And then we also support glaucoma treatment by providing equipment. Some of the equipment that you would have seen is really expensive. So one of our philosophies is strengthening systems. So we try to strengthen the health systems by equipping hospitals with some of the needed equipment. Thank you.
Now, for the period of time you have been into this, what are some of the worst eye conditions you have seen as you go down to advocate and to get resources to see which you support the most and which you give the most attention?
Yes, I'll talk about maybe two main ones. One of them is the glaucoma patients. There are some glaucoma patients who only found themselves blind for lack of information. And this comes as a tragedy because these are otherwise people who have enjoyed good vision in the past, but they had a condition which crept in and took away their vision. So these have been really very moving, and they cause us to mobilize resources to ensure that we prevent more people from having to go that path. And then we come across children who are born, for example, with congenital cataracts. These are opacities that some children are born with inside the eye. Now, these, if diagnosed early, can be treated, and then the child can have normal vision. But some of the children have ended up growing up without having an operation. So this causes us also to mobilize resources to ensure that we can identify the children at an earlier age. So they don't miss out on the beauty of God's creation. They don't miss out on education as best as it can be. So those are two main categories of people that I've come across.
Okay. Now, there are times when people feel a little bit devastated and they think that all the good things come to the people in Central, in Kampala. How far are you reaching to ensure that especially the people at the grassroots levels who need this kind of education, who need this kind of services, are taken care of?
Working in partnership with the Ministry of Health, we endeavor to reach out to districts that are outlying, that are far from the central. For example, this Child Eye Health Program, our main districts of operation include Kapchora, Iganga, Ajumani, Moyo, Hoima, Chikube, Tungamo. Most of these are really far away from the center, and we try to reach the difficult to reach in our approach. That is our main approach, trying to reach those who are difficult to reach. Yes.
And what recorded success have you gotten from these areas so far?
Well, so far, for example, last year we had children, over 100 children operated from children who had congenital cataracts and did not have access previously, but were identified and they were facilitated to access surgeries in various regional hospitals around the country. So we do that sort of coordination work, identify the children, then identify the nearest regional hospital where they can have the surgery done, facilitate their movement to that hospital and also back into the community. And then we also follow them up, because as growing children, there may be need for changing spectacles after they've had the operation.
Okay.
Yeah.
So what's your final message to a person watching you right now during this glaucoma week?
Yeah, during this glaucoma week, I would appeal to especially people who are age 40 and above to make sure they purpose to have an eye checkup at least once every year. And then even those who are below 40 and they are visiting eye health personnel for one reason or the other, it's not bad to request for pressure check just in case there is glaucoma.
Okay. Well, need I say more? I believe the doctor has put it out right and clear. We need to pay a lot of attention when it comes to our eyes, because once you lose your eyesight, there is no spare for it. Well, that is all we had time for. I don't think I need to ad-lib and add anymore. Doctor has put it out very right and clear. Now, I believe when you come to Malago Hospital, you'll get an opportunity to have some of these eye checks at the eye clinic, but also I'm sure they have an exhibition that is running out, and a lot of education information is passing out. You need to ensure you get to know about your eyes. Beautiful as they might be, you have them there and you think they're for decoration, but once you lose your eyesight, my friend, there is no cure for it. That is all we had time for. Keep watching UBC TV. Catch you next week, same time.
You Health Chat is a show that covers a variety of health topics to help people take control of their health. It is proudly sponsored by national medical stores who are mandated to procure, store, and distribute essential medicines and medical supplies to public health facilities in Uganda.